Okay, this is chapter 3, pharmaceutical terminology. A lot of this, I can only give you examples, but this is where your flashcards will come in handy. Knowing your root words and definitely your SIG codes. You will see those SIG codes on almost every prescription you see. So those abbreviations are what they are. You need to know. No ifs, ands, or buts. So, we'll talk about root words. A root word refers to the primary unit of a word. It can also be described as part of the word which contains the basic definition of the word. So what is a root word? It contains the basic definition of the word. In the medical field, root words are used to describe the human body, conditions, and components. So in the medical field, root words are used to describe the human body, conditions, and components. Words derived from Greek language are most commonly used to describe or refer to a diagnosis and or surgery. So we use Greek, and I don't know why they did this, but words derived from the Greek language describe a diagnosis or surgery, whereas words coming from Latin refer to anatomy. So Greek would be diagnosis and surgery, whereas Latin words is something to do with your anatomy. So most of these are dealing with your anatomy, as you will see. I have circled, highlighted some that you should know. Some of these are easy, some of them are not so bad. When you see them, we do not just study root words, it's something you remember. This chapter is so short, and the reason it's so short is because this is something you have to just get in your head. And when you see words, you'll be like, oh, okay, I recognize that. That's why that word auricle, A-U-R, you have an ear. A-U-R is the root word that means ear. So an auricle, A-U-R-I-C-L-E, is also what we refer to when we're saying ear. Cyst, C-Y-S-T, that is important. You'll see that a lot. Bladder. When somebody has cystitis, you would think they have a cyst, which most people think of a lump or a bump or something. But by the spelling, C-Y-S-T means your bladder. So when they have cystitis, they have a bladder infection. Itis meaning infection or swelling, inflammation. All of that is your itis. You still have some more words here. Again, I have labeled some that you must remember. But all of these you'll see, I just know that I have seen a couple of their certifications, if I just want to tell you, with those that are highlighted or underlined. So you definitely will see those. Dentures. You see D-E-N-T means tooth. So if we got dentures, that's where it comes from. And you will see that in a lot of places. Fetus, F-E-T. Fibula, that is that bone in your lower leg. Fibula. But all of these, you'll notice or know probably 85% of these without having to study so. But make sure that you do know what they mean. Okay? Next page. You will see some of these that you recognize as well. Most common one that you'll be seeing is oral. O-R means mouth. So if it's oral, it's practically by mouth. O-4 means ovary. You'll see that when they're talking about an oophorectomy. They took out the ovary. Oculitis. Onc means nail. So if you got oculitis, you got some kind of nail swelling, infection, something like that. That's what they would call it. All right? Just overview all of those, and you'll see some of those that you won't have to think about, while others you may have to put into your memory. Okay? Then you have your SIG codes. Again, these SIG codes you will have to know. You should have your flashcards already done and ready to really put these into your head, because these do not go away. They'll ask you 1,000 questions on your certification and your chapter test and your final. So do not let these go to waste. This is along with your medications. I actually want y'all to show me your medication list, or not list, but flashcards, if you will, or however you are studying, that has all of your medications on it. But here's your SIG codes, and you will see these all day, every day, because this is how people use and write prescriptions. A lot of times, let me just say AU. AU means both ears. When you have a U, I always think of two. So both ears, that's where the AU comes from. So if you have an AD, that is your right ear. So A for auditory helps you remember. D means right. Okay? And you'll see that a couple of times. Talking about OD. Your O is your right eye. OD is your right eye. And I always think the O looks like an eye. And D is always right. D is always right. A lot of people learn that little definition. D is always right. And you know, like, you know somebody named D and she's always right. Or D, he's always right. So D, right. Okay? And anything in front of it is going to describe what body part it is. So OD means right eye. Whereas OU, we already know U means two. And I always say it's shaped up and down like a U, just makes me think of two. PO, always, always, never forget, by mouth. PRN, as needed. Every HS. Q in SIG code language means every. So if you got every QS, that means every night. HS, hour of sleep. Every AM, QAM, every morning. Every other day, which would be QOD. They don't use that a lot because people start mixing it up with QID. So going over there, QID means 4 times a day. What do you reckon TID means? 3 times a day. And I think of, Spanish. I'm sure it's based on Greek. QID, cuatro. And that's ID just means 4 times a day. Whereas TID would mean 3 times a day. And I don't see that right now, but I'm sure it's on there. SS means 1/2. A lot of people will put half the pill, SS. A lot of times you will see without. And a lot of people will actually write and chart using that S, which means without. Know also that SX means symptoms. Know that your teaspoon is TSP. You can always know it's teaspoon as opposed to tablespoon, which will have a B in it. I'm just trying to think of the most important ones, the ones I've had underlined as well. MDI, meter dose inhaler. That's your inhaler when you having anxiety, or not anxiety attacks, but asthma attacks. Nebulizer. We give medications per neb, and you will see that means nebulizer. S without. GR means grain. There's a different medical problems that we will be getting to that you should know. And most of them are very easy. Not so bad. You do have to have a little math knowledge to get it. But grain is a measurement, just like inch. But grain is more of a weight. So y'all might already know that as well. Then you've got kilograms. We know what the kilogram is. A means before. So if I got AC, we just know that AC means before meals. And a lot of medications you're going to take before meals. Or you may take them PC, which is after meals. Your ear, left ear, is S. If you have an S behind an A. We already know A is for your ear. And an S behind it means left ear. And that goes for your eye as well. So I would be OS. Okay? BID. B as in by means twice. So twice a day. You've got DAW. And we mentioned it earlier. I don't know if I told you what it meant, but DAW means dispense as written. That means that's how just like it's on the box. A lot of times they'll use that when ordering over-the-counter drugs. Pepto-Bismol, DAW. Dispense as written. Then you got your drops or drop, but GTT means drop. These are things you're just going to have to get in your head. Once you see it 1,000 times, you're going to be amazed at what you know. But you now got to get it in your head. So GTT is drops. HS is at bedtime. IM is intramuscular. A lot of times what we're filling at a pharmacy is mostly pills, caplets, capsules, some liquids, a lot of antibiotic liquids we will fill. But just know that sometimes you will have to fill something that you may even have to mix. But a lot of times they make sure that person is trained to do that. There's actually a whole nother class for real mixing, like cancer drugs and stuff like that. But it is, and they don't call them, they have an extra certification behind their name. They're not just a pharmacy tech, is what I'm saying. Milligram is milligram, or mg is milligram. Milliequivalents, that is MEQ, and you'll see that as well when you are doing some, I'm trying to think, something that comes in milliequivalents. But they will still order, okay, you've got 1,000 milliequivalents. You are ordered 2,000 milliequivalents, so you know to give them 2 of that. There's your OS for your left eye. Make sure you know those as well. So this chapter is pretty much just looking, remembering. NPO, you're going to see that as well. Nothing by mouth. You'll see that a lot. Because they'll tell you NPO means nothing by mouth. Just PO means by mouth. So in your prescriptions, it'll probably say, Aleve 200 milligrams, PO, BID. PO by mouth, BID twice a day. And you're going to have to go through prescriptions like that to try to read them and see what it means. A lot of times you can just input it in the computer. And they tell you, or they just print it out. But you need to know. So when you're a patient, or when that customer asks you, what does that mean? You're going to be able to tell them. You have to. That is your job. So know your SIG codes. They do not go away. Right?